So now starting the clinical manifestation of multiple sclerosis. So let's start it. Let's start to heal. So basically, the upper motor neurons are spasticity. The upper motor neurons will become a spastic. There will be weakness and brisk reflexes and altered sensation of cerebral. Extra point that you should be consider is the mental function like depression, occasionally euphoria. Euphoria is basically excessive happiness. Autonomic, basically like urinary retention or incontinence. Impotence is basically erectile dysfunction, bowel problems. Okay. Now inspection. Atasic handshake. The handshake the patient will not do properly. Wheelchair, cranial nerves, intranuclear ophthalmoplegia. It is a condition when the eyes do not do when there is a prevention of induction adduction. Like the in previous picture, you can see this patient. The patient has basically suffering from the nucleophthalmoplegia. He cannot basically move her eye towards the medial side like it is moving away from the medial side, the left side, the right side, the eye. Then there will be optic atrophy, reduced vascular visual acuity, and many other cranial nerves palsy. Then we have actually now a very important point, which is actually Uthoff's phenomena. Uthoff's phenomena, what happened? There are worsening of the symptoms after hot bath or exercise. Lermet's signs means the patient has a worsened neurological symptoms after hot bath or exercise. Then what is actually Lermet's signs? Lermet's signs is basically lightning pains down the spine. It is actually lightning pain, so it downs the spine on neck flexation due to cervical cord plaques. Okay, now what happened that actually in this condition there is an electric shock sensation that occurs when the neck flexation and often radiates down the spine. In this, okay, Lermet sign, it is like basically due to the cervical cord plaques. Okay, now basically it is characterized by the chronic progressive deterioration in some and then remission and exacerbations in others. There were common signs symptoms that include motor, sensory, cerebellar, and emotional problems. Okay. Now, motor manifestations. If someone asks you what are the motor manifestations, so you will tell the paralysis of limbs, trunk, and head, double vision, scanning speech, and spasticity of muscles. Means your limbs will be weak, you will have double vision, scanning speech, and the muscles will be tight, spastic. Okay. Now other manifestations like of bowel and bladder constipation will be spastic bladder. In spastic bladder there are small capacity for urine that results in incontinence, but in flaccid bladder there are large capacity for urine but no sensation to urinate. Very important. Okay. Now how you diagnose this multiple sclerosis is basically based on the history, clinical manifestation, presence of multiple lesions over the MRI, laboratory test which is used adjacent to the clinical exam. Now you will take a history from the patient, clinical manifestation which I have told you actually like about motor, there is weakness of the limbs, basically double vision is present here. Then you see the so clinical manifestations were basically scanning speech. Okay, the patient will have then the patient will have actually Uthoff's phenomena means there will be actually um, worsening of the neurological symptoms. Then Lermet signs. Okay, then basically the upper motor neurons upper motor neuron spasticity you see, brisk reflexes you see, the altered cerebral signs you basically see. Okay, Now, now rule out also other causes of symptoms, but there is no definitive diagnostic test. If someone asks you, so there is basically no diagnostic test. MRI demonstrate presence of plaques. Okay,